To try to help reduce the incidence of repeat overdoses in the community, MedStar and the Recovery Resource Council have partnered up on a special program designed to provide additional resources to patients who suffer an overdose. Matt Zavadsky of MedStar is with me on the KRLD news line. And Matt, first off, how many overdoses have you guys been seeing?
You've seen an average of about 2 patients per day who suffer from an overdose that our crews have identified in the field. Now, that's fluctuated over time. We saw a little bit of a peak back in the end of the summer of 2022, but it remains pretty high. So when you're responding to, 60, 70, 80 overdoses a month, it's really important for us to work together with community partners to try and reduce, if not the overdose itself, certainly deaths from the overdose.
No doubt. And so one of the ways to do that is by reaching out, working directly with families of loved ones who have gone through an overdose. So tell us about this program and how it's worked.
Peer counseling has been proven to be very effective in getting people to be able to kick a potential habit that they have that could lead to overdose. So the Recovery Resource Council here in Tarrant County has an amazing peer counseling program. However, it's sometimes difficult for them to identify potential people that might want to enroll. And what they and we have found is that the day after somebody overdoses, or maybe even the day that they overdose, people are very motivated to perhaps become part of a peer counseling program to come off of whatever habits it is that's causing that overdose. So working with the Recovery Resource Council, when we respond to a 911 call for someone who is overdosed, we then refer that patient to our community health program along with the Resource Recovery Council. And within 24 hours to 48 hours, they go visit that patient and their family with the community paramedic, with a peer counselor from the Recovery Resource Council to try and enroll them in a peer counseling program. And in many cases, those patients are willing to do it because they said, gosh, I almost died yesterday, and now the family's involved. And we want to make sure that they have that resource available and some life-saving things if they need it.
And so what kind of results have you seen based on this proactive outreach?
There have been over 500 patients that have been enrolled in this program, agreed to peer counseling, and they've had tremendous results. So of the patients that have enrolled in this program with the Recovery Resource Council, we've seen an 88% reduction in 911 calls for an overdose in that population. And that is way far and beyond our wildest imaginations of success, because that's really the measure of the positive outcome, is people aren't overdosing. So we're not responding to them for a repeat overdose call, and that's really what we like to see. John, even if people don't choose to enroll, while we're there, we give the family instructions how to do CPR. We've left almost 1,000 Narcan kits with families so that if their loved one overdoses again, they'll be able to administer Narcan and, if necessary, know how to do CPR.
Incredible. Just a great impact. And so I would guess that, this kind of success means it continues to drive forward, and you guys are feeling like you're on the right track here as you continue to try to combat substance abuse.
Absolutely. And not only does it save lives, but it reduces 911 utilization, which decreases some of the demand on our first responders. It decreases the demand on local emergency departments. So literally, when we talk about win-win scenarios, this partnership between the Recovery Resource Council and MedStar is everybody's benefiting: the patients, the families, the healthcare system, the first responders. So we're really glad to see this program continue. It's had a huge impact.
And that is Matt Zavadsky from MedStar. Really appreciate your time.